Hi, my name is James Marin, and I'm the founding clinician here at Meelio. I'm going to walk you through how I use Meelio as a practicing provider and just how easy it is to go from consult to completed care plan in under 5 minutes. Now, depending on your setup, if you're a single practitioner or if you have a group practice, different EMRs, Meelio is a Mac app and a PC app. So it's going to connect to whatever you're using in terms of your EMR and your systems. We are confident here at Meelio that we can be a part of your beautiful admin systems and patient care systems, so the process is seamless. What I do as a practicing provider is, first off, I'm opening Meelio in my MacBook Pro. And when I'm opening Meelio, it is already connected and synced. If you don't know how to do that, we'll be showing you in another video, or there's also some great resources and links for you to check out to make sure Meelio is ready to go, is set up, is connected to your EMR, and you have all your templates, everything you need, so it is working for you the way you want it to work. Now, with Meelio open, I'm able to see my schedule, I'm able to see my visits for the day, I'm able to immediately start the visit if it's that time, or if it's beforehand, I'm able to push my preclinical note and make a new note in Serbo, which is the EMR we use. With that note open, I have Meelio ready to go, and as soon as my visit is ready to start, Meelio pops up on screen. I can either go into the Meelio app and click the button to begin, or Meelio will prompt me on my screen and I can start from there. Either option is going to be great. It is starting, it's recording my visit, and I'm ready to begin my initial or follow-up consultation with my patient. Now, during my visit, Meelio is live scribing. It's listening and hearing everything I'm talking about with my patient. It is gathering all that information. On top of that, is connected to the EMR. So it is collecting information from our EMR from each patient, whether that's their height, their weight, labs they've uploaded. Meelio is there and connected and ready to give you anything you need for your note and your care plan. Now, when I'm done, I just press stop recording. This is usually after I've already said goodbye to my patient and I've wrapped things up. I've scheduled their follow-up already with the patient. I like to do that at the end of my visits just to make sure continuity of care is there. And once they're gone, I'm able to stop Meelio. It takes a few seconds, maybe 30 seconds or so, to fully generate and complete the note. I'm looking in my Meelio chat box there, and I'm usually generating a meal plan. Because I am a dietitian, we have a dietetics practice with over 8 registered dietitians. We practice in an integrative and functional way. I like to give my patients a meal plan. Before, that wasn't always the case because it did take us a lot of time to make customized meal plans. With Meelio, each patient is getting a meal plan pretty much for every visit because it's so easy to generate. I'm there to ensure everything looks correct. I'm there to give Meelio some guidance if it is some very interesting and intricate details that only apply to our practice, as we are more integrative and gut focused. We deal a lot with IBS, SIBO, IMO, and ISO. We give Meelio some feedback there to make the best meal plan possible. Once that's generated, I can add more details if anything's missing. I can ensure Meelio is gathering all the correct information, and it starts to generate a clinical note and a care plan that is tailored to my liking. It's going to then push that into my EMR, which is Serbo, and complete the note for me. You can do some cleanup, and depending on your EMR, there is some spacing, there is some cleanup that I typically do. Maybe I'm adding some other handouts through my EMR. So once I sign and save my note, things are exactly the way I want them. The patient can access this summary through our EMR. So it's seeing the resources, the meal plans, the handouts, and my completed summary note for my patient that I want them to see in order for them to get the best outcome possible. I hope you are enjoying using Meelio as much as I am. If you have any questions, check out our resource page. And if you haven't started using Meelio yet, start your free trial today.